Hi friends, today I'll talk about snoring and heart health. Loud snoring could be due to underlying obstructive sleep apnea. Obstructive sleep apnea is a medical disorder which is associated with high uncontrolled blood pressure, certain cardiovascular diseases like heart attack, heart failure, fast and irregular heart rhythms, stroke, and obesity. Loud snoring, when associated with choking or gasping sensation, leads to interruption of oxygen supply. Decreased oxygen supply in blood puts strain on the heart, which in turn leads to high blood pressure. Uncontrolled, prolonged sleep apnea leads to high uncontrolled blood pressure levels, which may not come under control even with medications. Certain cardiovascular diseases are associated with snoring, which are heart attacks, heart failure, irregular and fast ventricular rhythms like atrial fibrillation, which may lead to paralysis. So, if you have loud snoring, do consult your local physician or cardiologist for further advice.